And also, a federal vaccine committee has voted to end the recommendation that all newborns be given the hepatitis B vaccine at birth. Now, this decision ends a decades-long agreed protocol urging parents to protect against the highly infectious virus leading to chronic liver infection in children. This vote considered a win for Health Secretary Robert F. Kennedy Jr., who campaigned to make changes to vaccine requirements. And joining me now to discuss is a specialist on immunology and former White House coronavirus response coordinator, Dr. Deborah Birx. Thank you so much for being here today. Appreciate you being here.
Good morning.
All right. Good morning, doctor. Okay, so what do you think of this decision that babies won't be required to get this vaccine? There's been so much back and forth on it. Help us understand.
Well, I was really hoping that everybody would take this opportunity to have a broader public health discussion. It's not that I'm against the birth dose, but something is putting pregnant women still at risk. And we should be concerned both about the pregnant mom and the baby. And I want to know what we are doing to ensure pregnant women do not get infected and they are protected in young adulthood. And so we have some really significant questions since we started the birth dose in the late 90s. Many of those women have reached childbearing age. Are they still protected against infection? And we know they're protected against what we call chronic active hepatitis, but are they protected against infection? So we need to be titering pregnant women. We need to be boosting them if they need to. And pregnant women who have never been vaccinated, we need to vaccinate them. I think it's okay to have a safety net for the babies, but let's figure out why we have failed women.
Yeah, and I got to tell you, I took my child in just for a well check recently, and my doctor, my pediatrician, started talking to me about all of this, saying, I mean, there's a lot of people that are really upset about this, right? That are trying to figure out how to talk to the parents who are listening to the back and forth and trying to figure out what is the right thing to do, and they're frustrated. The American Medical Association is calling the vote reckless, saying it undermines decades of public confidence in a, quote, proven life-saving disease. Louisiana Republican Senator and medical doctor Bill Cassidy denouncing the vote, saying this, that the change is a mistake, that the Hep V vaccine is safe and effective, and calling on the CDC director to strike the new recommendations. So, what do you make of that? And do you think that we'll see Congress intervene in any way? I mean, how's this going to play out?
Well, I'm really hoping that the public health experts, and certainly Senator Cassidy, who's given his life to hepatitis studies, really also ask, why aren't we protecting the pregnant women? Because the child cannot get infected at birth if the mother's been protected. And I always worry about when we focus only on one side of the equation, because we really want moms to be hepatitis free too. We don't want them to have chronic active hepatitis. We want them alive and thriving and taking care of their child. Mm-hmm. I remember with HIV, we started our HIV response in just protecting the babies from HIV. And then the moms died from HIV. And the babies were compromised because they didn't have a mom. So I'm hoping we take a comprehensive approach. I'm hoping, like Rubella, we get titers for pregnant women, we get them immunized, because we're 30 years into that birth dose. We should have protection across most pregnant women who were born in the United States. And so it raises questions about the broader public health agenda.
Yeah, and we're on this platform now talking about this, but more changes are expected to vaccine policy, as we've been told. President Trump himself ordering a review of all childhood vaccine recommendations. Yeah, the same committee will be reviewing all childhood immunizations right now. So what vaccine directive do you think will change next? What are you hearing?
I'm glad you're talking about this, because it's a perfect opportunity to explain to parents that, yes, their child is getting vaccines to protect that child and also create herd immunity. But there's other vaccines that their child is getting is solely to protect that child. And so I think having those conversations so that parents understand that these vaccines that they're giving are so their child can thrive. And I think we just have to have a better explanation of why we want children to be immunized. We focus a lot on herd immunity, but we should be focusing on that benefit to that child specifically.
All right. Well, we'll see where it goes from here. And it's great to have you on the program. I hope you'll come back as we get these changes or proposed changes. Immunology specialist and former White House coronavirus response coordinator, Dr. Deborah Birx. Thank you very much for joining us today. We appreciate it. Thank you.
Thank you for watching. Subscribe below and download our NewsNation app right now on your phone, and you will get fact-based, unbiased news for all Americans.